Hi there, I'm Dre, the host and founder of the Dragon Network. On this week's video, I want to talk about one of the projects in the FHIR Accelerator program called Helios. Helios is the newest FHIR Accelerator, joining in just 2021, and is focused on the interoperability of public health data. Before we take a look at what that project is up to, if you haven't had a chance to subscribe to the channel yet, please go ahead and do that now. And as always, if you like the content that you're seeing, don't forget to hit that like button. As I mentioned, Helios was launched by HL7 towards the end of 2021 with funding from the US CDC as well as ONC. The group is working towards creating the interoperability standards and the associated FHIR implementation guides for 3 different areas of data as they relate to public health. And those are the traditional public health data sources like vital statistics, data registries, and things like that, as well as EHR data from various health organizations across the country. And finally, they're also looking to define the standards for public health related interoperability for social data. There are 4 main aspects that the Helios project will focus on in the coming years, and those are, of course, to standardize and make data assets available for open access and FHIR-based API exchange, to broker that exchange, so to define the paths required for public health entities to participate in TEFCA. And if you aren't familiar with what TEFCA is, I'll put a quick link in the description below so you can check out a previous video that I've done on that topic. The third aspect that they'll focus on is federated query. So this will look at the access, query, and processing of information from sites across the US that support FHIR and bulk FHIR APIs. And lastly, they'll look at compatibility and sustainability to make sure that all the standards and implementation guides that are created can be carried forward as technology changes over time. So because the Helios project just got started in late 2021, the first portion of 2022, they're really going to focus on establishing the governance model for that particular project. So they're going to look at what structure needs to be in place to approve and define all of the things required. They're going to look at work groups and make sure that they understand which stakeholders need to be represented in each of those work groups as they go through their activities. And once those have been defined, they're also going to start defining which use cases they're going to use. So in the beginning, there's likely to be 1 to 3 use cases. There are some proposed use cases already forward on the table, and the definition period for defining which one they're going to focus on, I believe, is up at the end of March or beginning of April of this year. So an example of some of the things that the Helios group might be looking at would be real-time case investigation and outbreak response, which would help focus on the interoperability needed to let public health agencies know where they need to respond and what they need to do right away in the moment. We have, of course, improved some of our interoperability with activities that have taken place over the past couple years with the pandemic, but there is still a long way to go with public health, and with the Helios group defining some of these standards and implementation guides, hopefully we're going to get to where we need to be before the next pandemic comes around. So as I mentioned, initial funding was provided by the CDC and the ONC. It is anticipated that ongoing funding will be a combination of government, philanthropic support, and private sector entities. I will put a link to the Helios Confluence site below. Keep in mind, because this is just getting started, there's not a ton of data on there right now, but they will be adding things as they go forward, and I'm very much looking forward to see what this HL7 Accelerator group defines in the coming months and years. That's all I have for this quick weekly video. I hope that you have a great day, and I will see you again soon.